This skill will demonstrate how to provide denture care. Dentures, or false teeth, are worn by people who have lost some or all of their natural teeth. Your resident may have full dentures, meaning dentures for both upper and lower teeth, or partial plates that replace some teeth. Encourage your residents to wear their dentures as often as possible to avoid gum shrinkage, to improve their speech, to help them chew food, and to improve their appearance. When dentures are removed for a time, always store them in a denture cup in cool water or a commercial denture cleansing solution if your resident prefers. Dentures should be cleaned at least twice daily. Remember all the steps to be aware that you learned in the opening video as you prepare to provide oral care for the resident. Lay out and organize all the materials you will need for the denture cleaning. Have everything easily accessible before you begin.
I'll be right back, okay? I'm gonna get some things from the bathroom, okay? Okay.
Wash your hands carefully and thoroughly as demonstrated in the hand washing segment. Next, fill the drinking cup and the denture cup with cool water. After you have cleaned the dentures, ask the resident if he wants to wear the dentures or if you should return the dentures to the container. Use a paper towel to turn off the running water and dispose of it properly. Close the door or draw the curtain for privacy. It is important that you put on gloves when providing denture care.
Okay, Mr. Joe, I'm gonna put this towel on you so that we can
Place a
soil your
towel
nightgown,
over your
okay?
resident's chest to avoid soiling his garment. Pour some mouth rinse in an empty cup and have your resident begin with swishing it in his mouth. Follow with some water.
Okay. Okay.
Make sure you wipe the resident's face if any water spills. Your resident might prefer to remove his own dentures. If he would like you to remove them, use a paper towel or tissue to grasp them. A gentle rocking motion may be needed to loosen them as the dentures are removed.
And the upper one too, okay?
During the procedure, always ask your resident if he has any discomfort or other needs. Remove the upper and lower dentures in the same manner.
Good.
Place both in the denture cup for safety.
Now I'm gonna clean your mouth with this, okay?
Moisten the tip with water and gently
your mouth
swab
open.
all around the inside of your resident's mouth as well as his gums and tongue. Be sensitive to whether or not this is causing your resident any discomfort.
Okay. I'm gonna go to the bathroom and clean your dentures, okay?
Gather all the supplies you will need to clean the dentures in the bathroom. Dentures and plates are expensive and must be handled carefully to prevent breaking them. For instance, always use cool water on dentures since hot water can damage them. Place a towel on the bottom of the sink when you're cleaning the dentures. This helps prevent breaking if they slip from your hands. Hold the dentures over the sink and brush all their surfaces. Thoroughly clean both, then rinse the dentures with cool water and return them to the denture cup. In this case, your resident will be wearing the dentures, so he will not need to put them back in for breakfast. But if your resident does not want to wear the dentures, put them back at this time. Store them safely by putting them into the denture cup labeled with your resident's name and half filled with cool water.
Okay? Can you please open your mouth for me?
While the dentures are removed, inspect your resident's mouth for any bleeding, sores, dry or coated tongue, and odor. If you notice anything, be sure to report it to the charge nurse.
You like some denture
Your
cream?
resident may or may not choose to use denture cream.
Okay. I'm gonna try to put your denture in again, okay?
Ask your resident if he would prefer to put them in himself or have you do it for him.
Open your mouth for me.
Gently place the dentures in and ask the resident if he is uncomfortable or feels anything unusual.
Are you feeling okay?
Before leaving your resident's room, make sure you understand your resident's needs and review the ending steps that you learned in the introduction video. This helps to ensure that you make the accommodations needed to complete every procedure.